Hi everyone, my name is Megan Tarvis. My flashcard this week is on ovarian cancer. So I'm going to start with the disease process. Ovarian cancer is known as a silent killer. The silent killer phrase is due to because the symptoms are usually vague, unnoticed, asymptomatic. And when a person is finally screened or diagnosed with ovarian cancer, it's usually in a later stage, which leads to a poor prognosis or even eventually death. Unlike, for example, cervical cancer, you get a pap smear every 3 years. There's limited research on screening tests to diagnose ovarian cancer. Um, most cases that can be treated with chemotherapy usually have a high rate of coming back with reoccurrence. And unfortunately, 90% of cases that reoccur usually lead to death. Poor outcomes of reoccurrence is usually because they're unable to remove those tumors, they metastasize. And metastasis usually occurs through the process of peritoneal dissemination, in which we will talk about later on. Causes of ovarian cancer is usually unknown. There's not much information on ovarian cancer pathophysiology, but it can predicted that it can be affected the ovarian overall cycles after menopause or because of endometriosis. There's 3 different types of ovarian cancer: serous, mucinous, and endometrial tumors. And serous tumors are the most common type when someone's diagnosed with uterine cancer. Endometrial tumors, by its name, usually cause those who have history of endometriosis. Mucinous tumors are also dangerous because they could be known as benign or malignant, like a mix of it. So it's often difficult to diagnose or differentiate between metastasis and primary malignant tumors. What's dangerous about ovarian cancer is the peritoneal dissemination. This occurs when metastasis is present. Like with any cancer, metastasis can occur throughout it can start in one region of the body and spread throughout the body. Ovarian cancer cells travel through this fluid area through the peritoneal, and it's known as like ascites. And they create an environment and grow lesions in a different environment from the ovaries. So when this is diagnosed, peritoneal dissemination, it can lead to a poor prognosis, like we mentioned, because usually when they remove ovarian cancer by surgery, they're removing lesions at the cellular level. However, peritoneal dissemination goes into the peritoneal cavity, and it's failure to remove these lesions, which causes the overall prognosis of mortality and death. So the pathophysiology of peritoneal dissemination involves the original cells of the peritoneum. They'll transfer into the environment the tumor has made. Ovarian cancer manages the cancer cells, and the role is known as the planting the seed and growing in the environment phrase, with all basically metastasis. So ovarian cancers plant the seed when they travel to the peritoneum and they grow in that environment. Ovarian cancer manages that overall process. So the process basically is the cells from the ovarian cancer will detach basically from the lesion that was made on the ovary. And because the anatomy of the ovaries are more exposed to the peritoneum, it's easier for them to travel. And research has also hypothesized that the mesothelial cells, which is part of the peritoneum that like cover the top, and help with overall like organ mobility and basically hemostasis of the peritoneum, they also hypothesize that they also transform themselves into cancer cells and promote peritoneal dissemination process. The death rate is very high for ovarian cancer because when not diagnosis, the cancer spreads throughout your abdominal cavity, and it's making it more difficult to remove. So who's at risk? Obviously, women who are diagnosed with ovarian cancer, usually after the age of 55, thinking about like basically menopause, genetics too. If an individual's mother had ovarian cancer, they are at risk for ovarian cancer, just like any other cancer. Anyone diagnosed with breast cancer, uterine cancer, and colon cancer, history of endometriosis, infertility, anything that really causes that inflammation and damage to the uterine and the ovaries. So signs and symptoms, like I mentioned before, it's known as the silent killer, so it has a poor prognosis. Symptoms are asymptomatic at first or not really definitive. So thinking of symptoms, feeling bloated, feeling full, back pain, have pain after intercourse, feeling indigestion or frequent urination. These are symptoms you wouldn't think you have uterine cancer right away. Not like, for example, breast cancer, you feel a lump or change in the breast, like you might have a feeling, or the provider might have a feeling it's breast cancer. Someone who has a baseline like constipation or frequent urination, it could be with older age, not really thinking about evaluating for ovarian cancer, which is dangerous. So these symptoms don't confirm ovarian cancer, so diagnostic testing is needed. So let's talk about diagnostic testing. Ovarian cancer is questioned usually during a pelvic exam. So if women are not going to their usual annual pelvic exams, they're not feeling like confirming that there's a mass in there or feeling a large mass. So if it's a fibroid or benign, or is it malignant? So using a transvaginal ultrasound, many research states that transvaginal ultrasound is like the main diagnostic tool, as well as the serum biomarker called CA-125, which is a cancer antigen for ovarian cancer. Other diagnostic can be CT and MRIs as well, and that is my flashcard on ovarian cancer. My hope is that future testing will be done to evaluate individuals, as this is still a dangerous and definitely cancer for women who are diagnosed. Thank you for watching.